Hey guys, I'm Dr. Tom Dawson, and I want us to talk a minute about why my baby's yellow, and what's bilirubin, and what is jaundice. So, to better understand, we start back with we all have red blood cells that carry the air and oxygen all around our body, and those red blood cells last for about 2 or 3 months, so we're always making new ones and breaking down the old ones. And when we break down the old ones, they go to our liver, which is sort of the recycling center of our body. And in that recycling center, there's an assembly line. And one of the assembly line workers is kind of slow. His name's glucuronoltransferase. It's hard to say, so his friends probably call him GT. But in any event, he is a slow worker. And so these red blood cells, when they're breaking down into the various different parts, one of the parts is yellow, and it's called bilirubin. In any event, he gets behind on his work. And so the bilirubin starts building up at his station on the assembly line. If you watch old TV reruns, there was a classic I Love Lucy episode where she worked in a chocolate factory, and the chocolate would come down the conveyor belt, and she was supposed to put it in boxes, and the chocolate kept coming too fast for her, and the chocolate started building up. Pretty soon there was chocolate everywhere. Well, if you've seen that episode, then you'll understand GT's situation where there's just too much bilirubin and it flows out into the bloodstream and overflow. It will show up first frequently in your baby's eyes, then their face, then their chest, and then we'll move on down to the extremities. So when they're inside you, your body just takes care of this extra bilirubin. It just goes through the placenta and your body processes it. But once the baby comes out, their liver is all on its own. And sometimes there's just a situation where your body is making more bilirubin than their poor liver can process, and they will start to look a little bit jaundiced. So what do we do about bilirubin? Well, fortunately, way back in the old days in the 1950s, there was a really smart nurse in Essex, England, whose name was Sister Jean Ward. And she noticed, and back then children used to stay in the hospital for about a week when they were born, so she had a little more time to watch them. But she noticed that the babies over by the windows didn't get near as jaundiced as the babies over by the wall. And so she mentioned this to some folks, and some of the geeks got involved in it, and they realized that there's a wavelength of light that's about 460 nanometers, and that when that wavelength of light hits the bilirubin in the blood vessels near your skin, it changes it to a form that your body can handle more easily. And so because of that, you probably had friends where they became jaundiced and they put them on some special blankets, or sometimes even underneath some lights that sort of pump out this particular wavelength of light, and that then helps them process the bilirubin a little bit more easily. Other things that you can do to kind of help your child not get as jaundiced, keeping them well fed and well hydrated will help. Just like you've noticed when you get a little dehydrated, your urine gets much darker and more concentrated, or like the Kool-Aid, if you put more water in there, it makes the color more dilute. We can help them have lower levels of bilirubin just by having them better hydrated. Also, you can put them in your own home by a window where some of the sunlight is coming through the glass. The glass will let the 460 nanometer light come through, but it will filter out the harmful rays that will burn them. You can put their face in the shade and kind of turn them rotisserie style, and that will help them fight off the jaundice also. We don't want to put them in the backyard in the sunlight because they'll burn to a crispy critter in just a few minutes. So let's not do that. I don't want you to worry too much about bilirubin and jaundice. All children are going to be a little bit jaundiced. It peaks around the 3rd or 4th day, and then it tends to start getting better. Certainly if they start getting kind of basketball color, we want to take them into the doctor so that they can check and make sure that the level's not getting too high. And while theoretically, if the levels of bilirubin get too high, it can cause brain damage, I can tell you in the last 30 years of my practice, I've never seen a child have significant problems with their bilirubin. So we want to be aware of it, but we don't want to lose sleep over it. One of the nicest things about jaundice is once your liver gets caught up with the backlog of bilirubin, this is something that you never have problems with again. And those are my favorite kind of problems.